Hello and welcome to the screencast presentation for the Expert Practice module. My name is Angela Eddy. I'm the course leader for the MSc Advancing Practice in Radiotherapy and Oncology and also the module leader for the Expert Practice module. What I want to do is take you through very briefly a presentation about the Expert Practice module, what the entry requirements are, a little bit about what the Expert Practice module consists of, how it's assessed and perhaps how that might fit into some kind of an award should you want to go on and either get a PGC, PGD or the whole MSc in Advancing Practice. So first of all, who's this module for? This module is designed to support people who are working in extended or advanced practice roles or who are just about to be appointed into those roles. It's very much about building and demonstrating clinical competency at an advanced practice level. So the first requirement is that you're going to be in or very shortly moving into one of those roles. So something like a patient assessment and review role, a palliative markup role, breast markup, imaging, that kind of thing, but it's beyond the traditional scope of practice. We're really looking at people who are taking on delegated responsibilities. So is it for you? If you think, yes, I'm definitely in one of those roles, the best thing to do then is to drop me an email. I will have a quick telephone conversation with you about the further requirements. We really need evidence to support you, say from your manager, to indicate that you will have a clinical mentor or clinical supervisor who will look after you while you're on the Expert Practice module. That's because when we come later on, I'll show you, but you will undertake 15 case studies. You'll need to be signed off as clinically competent. You'll need somebody to assess your practice. So what we'll do then is we will outline what we call a tripartite agreement. It's an agreement between us as a university, yourself as a learner and also your manager, and we'll define what your scope of practice is, what your immediate and future learning needs are, and then try and tailor this programme to match that. So we'll negotiate some individual learning outcomes with you that will be well defined within your scope of practice. And that'll involve you doing some self-assessment of your learning needs, and we'll agree an individual learning plan with you. And we will need to be confident that you'll have these workplace mentors and clinical supervisors in place before you start the module, because they're going to be key to getting you started with your 15 case studies. So the Expert Practice module itself runs over 2 semesters. It starts in September and the hand-in is around May, June time. And again, it focuses very much on developing this clinical expertise. So it's about demonstrating you have those skills as an expert practitioner. So for that, we'll need to have defined exactly what your scope of practice is. Then we will tailor 15 case studies that will fit that scope of practice. So you will have 5 case studies where you will just observe your mentor. You'll write up the case studies, undertake a critical evaluation of that process. Then they'll move you on, they'll sign you off as competent, move you on. You'll take another 5 case studies where they will watch you, and you will again engage in some discussion, some reflective practice, and once they're happy you'll be signed off for those 5 case studies, and you'll move on to the final phase, which is the last 5 case studies where you're practicing autonomously, but you will retrospectively discuss those cases with your mentor or clinical supervisor. Once you've actually done that, you'll be signed off as competent. You'll have a special competency transcript that you will enclose in your webfolio. There are some generic learning outcomes in the module which look at things like legal, ethical and professional issues that are related to extending your scope of practice. You will also then have 2 individually negotiated learning outcomes. This again fits with your scope of practice, will have been negotiated and agreed between us, you and your manager, and that all links back to identifying very early on what your individual learning needs are. So looking at what the scope of practice involves, where you're at in terms of your own professional knowledge base, and thinking about focusing those 2 learning outcomes around the areas of practice perhaps that you want to elaborate on a little bit more. So how is it assessed? You provide us with a webfolio of evidence, and that's an electronic webfolio. We call it an e-portfolio. and you will be building evidence in this throughout the whole of the module. So once you start in September all the way through to May, you will have activities each month. We call them e-tivities. You'll share them with a tutor and also a small group of peers. You will all view and feedback on each other's work. Those small e-tivities will then feed into your final webfolio submission. So it gives you a chance to get some feedback and make improvements before you will submit the final piece of work. An example of those would be something like the legal, ethical and professional issues related to extending your scope of practice. So in the electronic portfolio, you'll also have those 15 case studies and the signed clinical competency transcript to say from your department that you are able to operate safely, reliably and consistently within that defined scope of practice. In the electronic webfolio as well, you will also then have a 3,000 word assignment. That will be one of your 2 individually negotiated learning outcomes, and you'll have another piece of work. Again, that might be something like a service evaluation or service review, or looking at a patient pathway. So it could be something like looking at a patient information package for a particular group of patients. So it's about you starting to look at, as somebody working in more of an advanced role, what's good practice, what does the literature say, what do we do in the department, and sort of mapping out perhaps areas that could be improved or identifying areas of good practice. So I don't want to dwell on this too much, but if you wanted to, this is a 30 credit module. You could take another 30 credits and apply for a postgraduate certificate in advancing practice. So here you can see your expert practice module is 30 credits. If you took another 30 optional credits, then you could, if you wanted to, exit with a postgraduate certificate in advancing practice. So an example of that might be if you were a breast radiographer who was reviewing patients, then you might want to undertake we have a specific breast module, and you might also want to undertake something like the informed consent in healthcare practice. So by combining those modules together, then you would come out with a postgraduate certificate in advancing practice, with the focus very much around your role as a breast review radiographer. If you do have any further questions or queries, I think the best thing to do is drop me an email and I will try and get back to you as soon as possible. Sometimes it's much easier to have a quick chat about these things, and especially about if you're not too sure if you fit the criteria to come onto the module, it's much easier to chat it through. So drop me an email with a contact number and I will get back to you as soon as possible. Thank you for taking the time to listen to this presentation.